And today is Tuesday, and on Tuesdays on Lifestyle, what we look at is your health. And this morning we're going to be looking at postnatal care. Last week we looked at antenatal care, and this morning joining me in the studio is Dr. Johnstoni Miheso. Welcome into the studio.
Thank you very much.
Johnston is a urogynecologist. Now that's a long title. And maybe we can start by first of all just demystifying what exactly is a urogynecologist. I understand urologist is for men, gynecologist for men?
Generally, urogynecology refers to disorders of the pelvic floor and the lower urinary tract in females. So it's actually a female specialty. So it combines female urology as well as the pelvic floor for women. The right doctor for men is actually a urologist. So we don't normally call him a female
male gynecologist.
As such.
Okay, just to understand. Okay, yeah. So urogynecologist is actually a different. It's not a combination of urologist and gynecologist.
It's a gynecologist who has studied the pelvic floor of women and the lower urinary tract, so dealing with the bladder problems and the lower urinary tract. And the sort of conditions we look at are things like urinary incontinence, and for the pelvic floor, conditions like fecal incontinence. So it's actually a female doctor and not a male doctor.
Not a male doctor.
Yeah.
Well, good to clarify that. And remember, for you at home, we certainly will open up the phone lines. They're going to be displayed on your screen, but you can also participate via Twitter, and that's on Michael G. Gitonga. I'd love to hear from you. If you have any questions for the doctor, feel free to do so. Just a quick reintroduction, Dr. Johnstoni Miheso, who is a urogynecologist. And today we're talking about postnatal care. Now, before we go to the postnatal care, let's just talk about just before the lady gives birth. I know this is normally a major concern for many. First of all, there is a lot of worry, there is panic, I think there's a period I've not been pregnant, but anyway, I've heard that there's a period that reaches and the woman just wants this baby out. But before we get to the baby out, are there certain things that a pregnant lady needs to be cautious about, aware of, that would help her with a good, safe, and healthy delivery?
I think most women will get a bit anxious, especially the first-time mothers, because they are not quite sure what labor is like and what they'll go through, and usually the issue of pain becomes a
matter of concern.
Yeah. What they need to have is a good midwife and a good obstetric care. So all the little concerns will be addressed during the antenatal period. And most importantly is to know what to expect and what time to expect. Most women will have sort of a natural birth. Actually, they go into labor themselves and they deliver vaginally. And we encourage that because that's the most natural and the less riskier of deliveries compared to a cesarean section. So if you are with your midwife or with your obstetrician and you're getting enough information, I think those worries shouldn't really be a big concern at all. And there aren't really major concerns, things that we need to sort of take off before delivery. I think as long as everything is going okay and you're monitored closely and there are no other complications, we just let everybody go into labor, usually around their 40th week, but it can go a little beyond and sometimes can come early. Okay,
so it's mostly a natural process.
Natural process.
But there's been, school of thought that there's certain exercises that would probably help you have an easy delivery. Is that true or is that myth?
It's true in a way, Michael. I think what we encourage women to do during the pregnancy is to start doing some sort of exercises. Mild to moderate exercise is actually quite healthy in pregnancy, and towards the end we want them to start doing pelvic floor exercises. That strengthens the pelvic floor muscles and also prevents problems postnatally like urinary incontinence and fecal incontinence that probably we'll talk about later
as we go along. Okay, there's been some who say walking is especially very good for one who's about to give birth.
And any mild to moderate exercise is good. They can swim, they can walk, they can do mild jogging, and that's quite healthy. Keep their circulation running and prevent any formation of clots, because women are actually at risk of developing blood clots, usually in the legs. They commonly referred to as DVT. So generally we encourage women to be active, to do exercises, and particularly pelvic floor exercise, where they're encouraged to clench their pelvic floor muscles and relax them several times a day. that does improve the pelvic floor and prevents postnatal issues, as we mentioned, incontinence and bladder control.
All right. We also have those who majorly have more complaints of swollen feet and back aches. Is that a matter of concern, and is there a way to avert that, reduce it, or is it just a natural process?
Most women will have a bit of swollen feet as a natural process, and backache again as a natural process, part of their pregnancy. When they're carrying a pregnancy, they use the normal mechanisms of actually even the back is not in the right usual position, and that sort of presents some challenges in terms of weight support. That can happen, and we encourage them to remain active, move their back about, and if they're desperate, they can take some painkillers, and Panadol is usually a good choice for that. In terms of swelling of their legs, again, that's a natural process. When the baby is in the tummy, it causes a bit of compression of the vessels inside the tummy, and that can mean that the blood supply from the return from the legs is not quite good. And we encourage them to keep active again, put their legs up when they rest in the evening, and that sort of thing is actually quite innocent. However, there's another small category of women who might develop something we call preeclampsia, which comes with swelling. So if the swelling is not only on the legs but comes to the hands and face, we need to investigate that a little bit further, and that may mean that the pregnancy could be at a slightly increased risk than the natural process.
Maybe without going too much into detail, what is preeclampsia?
Preeclampsia is a condition that happens in the second part of pregnancy, and usually comes with elevated blood pressure. So their blood pressure goes up, and they develop the swelling that I mentioned, and then there are problems with handling protein in their kidneys, so they have a lot of protein coming out in the urine. It does, we quite don't understand what causes it, but it does interfere with the way the baby is surviving inside the uterus, and some babies actually fail to grow up optimally and need to be delivered quite early. For the mother, the hypertension can present challenges, and one of the things that we want to make sure is that we control the blood pressure. Just like in a pregnant woman, that can cause complications, which include stroke and things like that.
All right. Now let's move on to the actual childbirth. And one of the things I know that over time, I mean, in the olden days, would have every woman give birth naturally. And of course, that sometimes has complications. But in today's age, there is a notion, especially there's a concern of pain, and there's an option of cesarean section. Now, as a doctor, from a doctor's perspective, what would you advise one to do if there are no complications? Because I think one of the things that, you know, somebody may have mentioned, I was reading somewhere, that the advantage of cesarean section is that you can actually time it. You can say that I'll go into labor on this particular day, and of course now go through the process. But what's your opinion on that?
I think we've got to be careful about what has happened in the past and what is happening presently. I think nothing has actually changed much over the years, and it's still encouraged that women go through the natural process, because that's the less risky of deliveries. So we only recommend cesarean sections when there are clear indications on why we need to do it. And some of the indications could be that the afterbirth or placenta is in the way of the baby, or the baby is coming with the bottom first, and those are clear indications for cesarean section. Otherwise, the aim is to try and keep things as natural as possible. And I'm quite sure that women who have gone through a natural birth really appreciate how good it is, and they're back on their feet very quickly, looking after their children without the problem and the risks of a cesarean section. So we usually recommend cesarean section when there are clear indications. The most common of which, during labor, the baby can become unhappy. That means the heart rate may go up or start to drop, and that's a clear indication for cesarean section. So we aim to have things natural, and that's the default actually. Cesarean section on requests are still quite very few, and we usually want to be sure that we can address the woman's concerns. And a lot of the things, as you rightly pointed out, is usually about pain relief, and we know that we have options of making a woman comfortable and probably avoid an unnecessary cesarean section.
Okay. So there is no particular advantage of the cesarean section apart from the fact that if there is a health concern, a risk involved.
I mean, apart from what you said before, the timing of it, you know, the day when the baby is going to be born, really all the risks of a cesarean section are maternal. So the bleeding, infection, blood clots and things like that, a risk of accidentally injuring an internal organ are all maternal risks. the baby will obviously come out bouncing, and usually babies don't actually have much problem apart from a small risk of breathing problems, because a bit of stress of labor is actually thought to be good for babies. So apart from that, the disadvantage is actually,
Okay, and you've mentioned there are options of pain relief, because I know one of probably the highest reason for many thinking or considering cesarean section would be the painful process.
Yes, we do have quite a few options. I think the olden days is when mothers just labored in the village, usually without any pain relief. But at the moment, there are quite a few things that are available, and most mothers who attend very good obstetric units will actually be taken through those options. Some of the things we offer are injections that can take the edge of the pain away. We can give gas and air, and we also have an epidural, which is a completely painless labor. And then there are other non-pharmacological methods, which include breathing exercises, using the water bath and things like that, that are actually available for women. And I think women should actually engage their obstetrician or the midwife to try and explore what options are available, so that this thing about labor and pain can actually be discussed and sorted out.
All right, we're going to go into some of the complications that one may experience, but just a reminder at home, in case you're joining us now, we do have Dr. Johnston Miheso, who's a urogynecologist, and today we're talking about postnatal care, and specifically looking at the mother as opposed to the child after the child has been born, because that would probably be the area of a pediatrician. So we are concentrating more on the mother, and this is after birth. Now, Daktari, what are some of the complications that may come up after, a natural birth? Maybe let's start with natural birth, because we'll still go to CS.
Okay, natural birth, maybe it's easier to compare it with cesarean section, actually carries very few risks. And one of the things that could happen during delivery is possibility of increasing the birth canal by making a cut, which we call an episiotomy, and that is usually repaired immediately. However, a number of women will actually get what we call a perineal tear, which is a tear of the muscles of the pelvis. It's usually repaired, and most times it actually goes back together well. But a small number of people get a tear that involves the muscles of the back passage, so the anal sphincter. And that's when they develop problems with controlling stool, whether liquid or flatters, and can also fail to control urine. So that's usually one of the major concerns about delivery. Some women may feel that even after repair and after the cut or the tear happens and it's repaired, it doesn't go back quite well. What is useful to know is that these women can actually be offered a postnatal follow-up, where we can actually reassess the tear or the damage that was done and do a secondary repair. So that's one major concern. And then some mothers, again, after delivery will develop urinary incontinence. That's why I emphasize the fact that if you are still pregnant and you're doing your pelvic floor exercises, practicing to clench your pelvis, postnatally you have a smaller chance of developing urinary incontinence. However, if it does develop, we can also still follow up and offer treatment, and the treatment range from giving medications to doing a little operation to tighten the bladder neck. So these options are available, and women who often suffer in silence should actually come forward when they develop problems like this.
Okay, you've talked about the perineal tear. Is this one that is done by the gynecologist at the time of birth, or does it just happen as the baby is coming through?
Both, actually. What happens with the baby is coming through and the birth canal is being stretched completely, we normally actually recommend one makes a small cut, which is easier to repair. But some women will actually get, even after we make a cut, they can still get an extension of that, so which comes up to a tear. So we're talking about both the cut that is made deliberately, which is an episiotomy, as well as the perineal tear, which has just occurred spontaneously.
Okay. All right, we'll continue that, and I'll take a call from Sharon in Kitale. Good morning, Sharon, and thank you for calling. To your question or comment.
Okay, my name is Sharon. I'm a mother of 3, and I'm expecting my 4th child.
Okay.
I'm 34 weeks pregnant now. And I wanted to ask Dr. because this time around I wanted a TL conducted. So I was opting to go through a CS. My other 3 children have gotten them through the normal delivery. So I wanted to ask if it is okay.
Okay.
Yes.
All right. Thank you very much, Sharon.
Okay.
All right, and if you're at home and you'd like to participate in this conversation, feel free to do so. You can give us a call. The numbers are now displayed on your screen, or you can also get in touch with us via Twitter, and that's at Michael G. Gitonga. Now, to Sharon's question, who has got 3 children. She's 34 weeks expecting and would like to go through a tubal ligation, and she's asking if that's okay. And I guess, what's the process?
Yeah. Sharon, that's a good question, and I appreciate you're bringing it up, because I'm sure some few women actually will have similar circumstances. The general advice, if Sharon has had 4 children vaginally, I would recommend that she goes through a vaginal birth, and a TL can be arranged separately. The risks for cesarean section are far outweigh the risk for doing a BTL separately. So I would recommend that she goes through a natural birth. What we can offer her immediately after delivery is to do a little operation, which we call mini lap, to tie off her tubes. That can be done immediately after delivery, actually. So she can leave the hospital with it having been done. The alternative to that is to wait after 6 weeks and do a keyhole procedure and tie off the tubes, which is the BTL.
What's BTL? What is BTL?
BTL is bilateral tubal ligation, sorry. Okay. And it just means a permanent contraception for women.
Okay.
And we need to let Sharon know that there are also alternatives to BTL, and we know that it can still fail. Most women go for it knowing that it's actually permanent and irreversible and 100%. In general, there's no contraceptive method that is 100%, including sterilization, which is the bilateral tubal ligation. So I would think Sharon has the option of the other methods, which include a coil as well. And but if she's decided and she has had this discussion, we can offer tubal ligation at the time after delivery.
After delivery.
Yeah.
Is there a difference in terms of advantage as for her to have it immediately after delivery, or wait the 6 weeks?
Good question again, Michael. I think the usual practice is to wait up to 6 weeks, but we know for several reasons women want to combine this thing while they're still in hospital, get it all done and dusted. The advantage of doing it later is that the tubes, after the changes of pregnancy, make the tubes quite big. So the efficacy, if you do a bilateral tubal ligation, is slightly lower. It's thought to be slightly lower if you do it immediately after delivery than if you do it after 6 weeks, when all the changes of pregnancy have gone back to normal. So there's quite, I would think if there are pressing reasons to do it immediately, we always offer it, but ideally probably do it after 6 weeks when the changes of pregnancy have gone down again. Now,
you've mentioned it as a method of family planning. Is it reversible?
No, it's irreversible.
It's irreversible.
So women going for this should know that it's irreversible, and they need to have be sure that they have completed family. It's one of the reasons why we normally again try to counsel them about doing it immediately after delivery, because God forbid, who knows what is going to happen in the early days after delivery. So that discussion needs to have happened quite early, and I think Sharon's looking at her question, I think she's already thought about this, and she's decided.
And I guess this is a conversation just on a social level to have with your spouse. So that at least they know that this is an irreversible process.
And just to mention before we finish that there's a male alternative to BTL, which is vasectomy.
Okay.
And it's much more effective. Failure rate is much more smaller. It can be done under local anesthetic, and I think that conversation again needs to occur between the couple.
Okay. And well, is it myth or truth that sometimes it may lower the man's libido if they go for the vasectomy?
No, that's myth actually.
That's myth.
It doesn't affect libido at all. I think probably in the mind of the men, and I think that's something that we need to dispel.
All right, okay, let's go back to the perennial tears, and you are talking about them being sometimes one may experience them. The doctor may actually put a tear, but may also experience a further tear as you're going through delivery. What's the procedure to repair this?
Generally, if you have a small tear, we generally classify them into 4 types. There's 1, 2, 3, and 4. And if you have the first 2, they can generally be repaired in the room, the delivery room. But when you have a major tear which involves the muscles of the back passage, the sphincter of the anal sphincter, you need that to be repaired in theater. That means you need a good light, you need sterile conditions, and an assistant probably, just to make sure that you put all the muscles back together. So sometimes you can actually do a good job of putting them back together, and eventually you get something, unfortunately get an infection, or the wound just breaks down. And such breakdown actually can lead to incontinence of stool later on in life, where you cannot control the stool as it comes out. So it needs to be repaired, generally using stitches that are dissolvable. They dissolve, they don't need to be taken away. And it's usually a process that takes about 30 minutes or so after delivery. It's minor surgery. It's minor surgery.
All right. We'll take a call from Eldorado in Edward in Eldamaravin. Edward, thank you for calling. Your question, sir?
Yes. Good morning, Dr.
Morning.
Good morning.
Good morning.
I'm calling from I'm calling from Eldamaravin.
Okay, could you please speak up a little bit so that we can hear you, sir?
Okay. As I said, I'm calling from Eldamaravin. I'm Edward. In fact, I'm Edward Moy.
Okay.
Now, my question is, normally before the onset, before delivery, my wife normally develops huge swellings around the anus. And in fact, for my first baby and the third one, it really developed so big. So I went to maybe what they will do, they will operate, they will do some operations. The swellings are a bit huge, they are big. And so in fact we stopped.
Okay, Edward, I'll need to hear you. Maybe just go straight to the question.
Yes?
Yes, I've got the history of it. Please go straight to the question and speak up a little bit so I can hear you, or we can hear you.
The question is, hello?
Yes, go ahead.
The question is, what really can we do as a family? Because this thing has become a big problem. In fact, we are not even ready to get the other baby. So I wish to get your advice.
All right, thank you, Edward. Okay, we also have another call. Rehab, good morning, Rehab. Thank you for calling, and go straight ahead to the question or the comment.
Good morning, how are you?
Very well.
Okay, my name is Rahab. I'm calling from Rongai. Yeah, of late I've been having, I'm 27 weeks.
Go ahead.
Okay, I'm 27 weeks. And I've been having some abdominal pain. And actually, sometimes they're a bit painful. And I just wanted to ask your doctor if that's normal. And also, just to ask, when is the best time to stop having sex when you're pregnant?
All right, thank you very much, Rehab.
Okay.
All right, okay. Remember, you can call and ask Daktari your question. In case you're joining us now, we do have Johnston Miheso, a urogynecologist. I'll take Judy's question. Judy, thank you for calling to your question.
Okay, my name is Judy.
Yes, Judy, go ahead.
Okay, I'm asking the Daktari, what is the merit and demerit of both horizontal? What is the merit and demerit of both horizontal and vertical cesarean? And then, like, for example, for me, I had a horizontal cesarean, and right now I'm expecting twins. And I've been advised that the vertical one will be the best. Now, what are the merits or the demerits of such?
All right, thank you very much, Judy. Thank you for calling, Judy. I'll take Miriam as well. Miriam, thank you for calling to your question.
Okay, sasa nilikuwa nataka kuuliza daktari. Niko na nimefanyiwa 4 cesarean. And the scar wakati kuna baridi na kuanga very painful. Sasa niko namuuliza what is that wrong? Alafu sasa nasikianga some people say when you have scar is it true that inakuanga nini cancer after some time?
Okay.
Thank you.
Asante sana Miriam kwa kupiga simu. And Daktari, quite a number of questions there. Let's start with Edward, who they're expecting, I think, their third child. And he says that his wife normally has huge swellings around the anus. So the question is, number one, what causes that and what can they do?
Edward, that's a valid question. Again, quite a few women will end up with what we call hemorrhoids, and they're just usually swellings from the back passage. It's the blood, because of the weight of the pregnancy, again, the blood return from the lower end of the bowel, which is the rectum, doesn't quite come up as well as it should. What we do for this, usually don't do anything in pregnancy or give pain relief, make the woman comfortable, and afterwards we normally think if they're causing trouble or outside pregnancy, they need to have some sort of treatment. And the treatment is usually either injecting some medication that can shrink them away, or just doing surgery to take the hemorrhoids away. So that can be arranged usually after delivery.
Is there a particular reason why they're in a certain area?
Yes, again, the blood supply to the lower part of the rectum is actually can come from either the bowel up or from outside the muscle. So that sort of connection between the inner supply and the outer supply makes it more likely to develop those swellings, because when you're pregnant, again, the blood return from that area is not as good as it is outside pregnancy.
Okay. So
that's quite a recognized complication, and I think a good evaluation after delivery would be what I would recommend, and a possible way forward in the case of surgery or injections to try and shrink
take
them.
care of that. Any major concern regarding that in form of getting other children?
Not really, no. It's likely to recur though in subsequent pregnancies, but again, we can always deal with it in terms of making the woman comfortable.
Okay.
So that eventually has to be dealt with permanently. I think if it has been recurring in the previous pregnancies.
All right, let's go to Rahab's question. She's 27 weeks pregnant. She's experiencing some abdominal pains, and she's asking if that's normal, number one, and secondly, when is the best time to stop intercourse when you're expecting?
Abdominal pains are quite common in pregnancy, and the best thing is to actually always share it with your midwife or obstetrician when you visit. We need to know what is normal and what can actually potentially be something to worry about. So mild pains that don't progress and go away after a short while are usually normal. And the commonest thing is that the uterus is growing quite big with the baby. So ligaments are stretching, and that gives a bit of ligament pain that is quite common in pregnancy. Again, we normally recommend for mild pains, you just take Panadol and keep an eye on it. But if you get pain that is worrying, you need to have it checked so that we exclude any possibility of something worrying.
How does one determine when it has crossed the normal?
I think
because that becomes a bit difficult to define.
The best thing is to actually have a chat with your midwife or obstetrician every time you visit, so that you describe what you're feeling. Most times we offer you an examination to have a feel of whether things are still looking right, the baby is fine or not. So that is usually something individualized actually at the time of assessment. What I would say is that what doesn't look right, make sure somebody knows about it so that they can give appropriate advice. The second question about intercourse, intercourse is quite safe in pregnancy, and you can have intercourse throughout pregnancy. There's no limit to when to have intercourse.
Okay, there's never a time that it's not at this point you have to stop.
No.
Okay, there's no risk to the baby.
No.
All right, there's a question from Judy, who says she has gone through several CSs, cesarean sections. She's expecting twins now, and she wants to know the merit vis-a-vis the demerit for vertical and horizontal CS, and she says that she's been advised that vertical is the best for her.
For Judy, I think the advice that you've been told is actually not probably quite true. Before people did cesarean section vertically, the only advantage with that is that there's very little blood supply in the middle, so most people will not get a lot of bleeding, but it tends to form a weaker scar, and generally it causes more pain compared to the one across. Even if you had twins, you still can actually deliver them with a cesarean section done using the incision across the tummy. So I would think for her, again, the best incision would be the one across the tummy. Okay. It's less painful, it forms a stronger scar, and generally it's more preferable for women because it also doesn't appear as ugly as the one that goes up and down.
Would there be a reason why she had been advised that vertical is better for her?
I'm not quite sure about that. Actually, I couldn't think of a reason. The main thing about doing a cesarean section is to have adequate access to the baby, and if you can get that through the incision across the way, I don't see why you could actually do
go vertical. Maybe she should ask that to the person who advised the doctor to give her reason, if at all there is any.
Yeah.
All right, we have Miriam who called, and she's had 4 cesarean sections, but she's complaining of pain. She gets pain especially when it is cold, and the second part of her question is the relationship, if there is any, between cesarean section and cancer.
Your second question is probably easier to tackle. There's no relationship between cesarean section and cancer. I wouldn't think of any cancer that actually increases when you have cesarean section. This first question, it reinforces the fact that we actually encourage women to have natural birth because it causes less problems in future. If you've had recurrent cesarean sections, obviously you're cutting through muscle, you're cutting through nerves and things like that. So you tend to interfere with the sensation around the wound, and for more than one reason you can actually end up having disturbed sensation there. And that's one of the things I'm sure she is complaining about. I think
the cold and pain.
No actual direct relationship I can think about. But as I said, when you cut through nerves and muscles, you're actually likely to interfere with the natural process. And I think she's having one of those rare complications related to that. Scar tissue that has formed.
No cause for concern.
No cause for concern at all. It doesn't mean cancer at all, if that's what you were suggesting.
Okay, Sawa. Going back to the complications, you mentioned the perennial tear, which you said is reversible and can be looked at. Are there other complications that one could experience after giving birth, natural birth?
I think the main ones are actually related to the damage of the pelvic floor. And as I said, that will be in the form of the tears as well as the sequelae to that, the tears. So we mentioned about urinary incontinence, and usually most of it is reversible. Actually, if they do exercises after delivery, the pelvic floor exercises, they actually do reverse urinary incontinence, and they could do quite a bit in helping fecal incontinence as well. But as I said, if eventually if these symptoms are persisting up to 12 weeks after delivery, it calls for another review so that we can actually address whether there's any anatomical or structural defect in the pelvic floor. So we can do another operation to try and strengthen the pelvic floor and get rid of that.
Okay. Are these urinary incontinence and fecal incontinences something common? Because I imagine that one of the things that may hinder new mothers from having it tackled is it's somewhat embarrassing that you can't hold, and you might think that it's a unique thing. Is it common? Is it something that one should not be embarrassed and maybe approach a doctor to address?
I think it's quite commoner than we see, actually, because it's an embarrassing complaint, as you've just pointed out. Most women will not come forward to tell you about their incontinence. And what I encourage women is to talk about these things. And the other problem may be from our side, healthcare providers, who may actually think that having had a natural birth, maybe it's normal to have problems with their bladder or stools. So women outside there may be suffering, and the incidence actually not quite clear even worldwide, because it's an embarrassing complaint and people keep quiet about it and probably just share with their partner in the house alone. So it's something that we should encourage women to come forward and discuss with them.
And it is treatable, so it's really treatable, it's something that you don't have to suffer with for a long time.
No.
Okay. Now, once you've given birth naturally, what should be the expected time of recovery from the time of birth to now when you somewhat get back to your normal self?
It usually just takes about 6 weeks actually before the body goes back to its normal. And by 6 weeks, the good thing about natural birth is that that's a faster way of getting back to normal. And even when you say 6 weeks, it doesn't mean that the woman can't move around, can't feed her baby, can't cook for herself, wash herself and things. It becomes different when you have an operation again. Although we say it's 6 weeks back to your normal, to your pre-pregnancy level again, pre-operative level, you still have to deal with a lot of problems with the scar. So natural birth is actually quicker, and most women are back to their feet as soon as they've had their baby, actually.
Okay. Anything that one should avoid doing, like lifting heavy things because of your back, or?
I think just be sensible about things. Actually, we don't lift too heavy things, but most people can do
go about their
normal
duties. Okay, we've talked about the complications during natural birth. What about cesarean section? What are some of the potential challenges that one may face after?
I think the first thing about cesarean section is that you already have attendant risks of the operation itself. And one of the things unique about cesarean section is that the uterus or the womb is supplied with a lot of blood to obviously keep the baby growing inside them. As soon as the baby is out, we usually need to close the uterus quite quick. One of the biggest risks is bleeding. And to sort of prepare, we know that some blood is actually inevitable during cesarean section. And to sort of prepare ladies for this, we normally advise them to take some iron tablets to build up their blood level. Only again when we have evidence that it's actually lower than we expect. So we need to deal with the blood loss during the cesarean section, and some people actually have a blood transfusion as a result of that, and that has its own attendant risks as well. And some people end up using iron tablets for a while after that. But together with the blood loss, again, infection is a risk at cesarean section. We know we give antibiotics, but some people actually get very awful infections that can take a while to control. And then risks, as I said, like DVT are quite real risks during cesarean section. Subsequently, as we saw one of the callers saying, you can actually end up having scar pain that persists for a long time, and some people will have that, some people will not have that. And once you've had a cesarean section, there are implications on your next delivery. So what are you going to do next time? We know that we have a good chance of having a natural birth after cesarean section, and studies have shown that up to 75% of women can actually deliver vaginally after a cesarean section. That means if you took 4 women who have had a natural birth, who have had a cesarean section through natural birth, 3 out of 4 of them will actually have a normal birth, which is a good chance, and we encourage women to go that way, because that way has less risks, as we pointed out. And long term, again, after you've had an operation, you form a scar tissue inside your tummy. That means if you have to have any other operation for any other reason, again, that can present a higher chance that you can damage an internal organ. And some scar tissue can also cause pain away from any operation, even without having to do anything at all. So there are quite a few things that we need to be aware about when we choose cesarean section. Although we know that women who have had cesarean section have the choice of natural birth or cesarean section, we need to offer them this information so that they can make a reasoned,
an informed choice. Okay, we have John Eric on the line. John Eric, thank you for calling, and straight to your question, sir.
Hello.
Yes, John Eric.
Hello to you. I'm calling to...
Hello?
I'm calling...
Yes, John Eric, please go ahead with your question and please speak up.
Okay, I'm from Kakamega. I wonder that my wife is rhesus.
Your wife is?
Rhesus negative.
Rhesus negative,
Yeah, rhesus negative. Hello.
Yes, please go ahead.
The first time.
Okay, we seem to be having a problem with that call. John Eric, I can hardly hear you. Please go straight to the question if you're still there. Okay, I'll take another call from Ryle. Ryle, thank you for calling. What's your question?
Yes, I'm 2 weeks pregnant, and I'm having bleeding on every 1 week.
Bleeding?
A lot of bleeding, yes. I really bleed, like on Saturday I really bleed, which disappear after around 4 hours. Then I have lower sharp abdominal pain.
Okay.
Yeah, so I'm inquiring, is there anything I can do about it? Is this bleeding normal?
All right, thank you, Ryle.
Okay.
Thank you. Yes, do we have John Eric? Or okay, let's go ahead with Ryle's question. She's 2 weeks pregnant, and she's bleeding every week, and she says she's really bleeding, and it disappears after 4 hours. Your comments or concerns?
Yeah, bleeding in pregnancy can be a worrying complaint, and I think what she needs to do is to attend to see a doctor so that this can be assessed to determine where the bleeding is coming from. And then to also do an ultrasound scan to see whether there is any problem with her pregnancy.
Would one be bleeding, or would there be concern if she's pregnant for 2 weeks?
I just don't know how she... Yeah, it's such a short time. I'm not quite sure how she assessed that, but I think the best thing for her is to actually have it as properly go to a doctor and have it assessed, so that we establish where the bleeding is coming from.
Okay. But bleeding naturally for a pregnant woman is a matter of concern.
It's a concern,
should be treated with urgency.
It means that the pregnancy is at risk, actually, so it needs to be assessed. So I would recommend that she goes to be seen. And I'm hoping that she has had her pap smears and things, cervical screening done, so that we know that it's not from anywhere else apart from the pregnancy. That can be assessed at the hospital if she attends.
All right. Okay. And interesting there. Maybe just before I bring in Sophia, my colleague, and see if she has any questions or comments that you'd like to pose to you, maybe based on what's coming through. You talked about the cesarean section complication, and one thing we didn't look at is what's the normal time of recovery. We talked about 6 weeks for natural birth. What about a cesarean section? Is it the same time?
Natural birth should actually be quite fast. What I referred to was the time it takes for the body to go back to the non-pregnant state. But natural birth is actually as quick as anything. You have your baby today and tomorrow you're walking around.
What about CS?
Cesarean section takes 6 weeks before your body actually recovers completely from the operation itself. It takes a bit longer for the stitches we use to dissolve, so quite a lot of people are still in a bit of pains long after the event. Can take up to 1 year actually before they fully recover from it. But uncomplicated cesarean section, the body goes back to normal about 6 weeks down the line.
6 weeks down the road. All right, I'm going to bring in Sophia now. And Sophia, very interesting conversation here we're having on postnatal.
Indeed. Again, it's the future of this country. When we have
when men have this conversation.
When men have this conversation, this is a good thing. It's good to know that you're part of very important aspects of a women's health, maternal health especially. So
absolutely.
Yeah.
All right. And yeah.
So we're going to end it there.
There's a call from, I think, Caro in Bahati.
Oh, okay.
Caro in Bahati, your question?
Yes.
Before we finish.
Hello.
Yes.
Sorry.
Yes.
My question is, I have gone through pregnancy twice, and I had 2 ectopics. One actually burst, and I went through a lot of pain. I had a second ectopic about 4 months later. I'd just like to know what could be causing all these 2 ectopics in a period of 4 months.
All right. Thank you, Caro.
Thank you.
Okay, we also have Virginia before we wind up. Virginia, thank you for calling your question.
Okay. Jina langu naitwa Virginia. Nimeolewa for 2 years now.
Yes, nakusikia.
Na sasa wakati nilienda hospitali sijakuwa hivyo kuconceive. Sasa venye nilienda hospitali nikaambiwa niko na ovarian. Sasa nilikuwa nauliza lazima mtu afanyie operation na tolewe hiyo ama anaweza, kuna dawa zile mtu anaweza kutumia?
Ati lazima mtu
aende afanyie operation na tolewe hiyo ama kuna dawa mtu anaweza kutumia?
All right, asante sana Virginia.
And then kuna nilikuwa nitaka hiyo inaweza zuia mtu kupata mimba.
Okay. Asante sana Virginia. All right, 2 questions there. One is to do with ectopic pregnancies, and she wanted to know what's the way forward. Maybe your response to that.
Yeah, ectopic pregnancy means that the pregnancy has actually formed outside the uterus, and the common place is the tube. And usually the egg actually transported back to the uterus along the tube. For you to have an ectopic pregnancy, it means the process is not able to complete because there's some sort of damage inside the tubes. Once you've had an ectopic pregnancy, you are at more risk of developing another one compared to somebody who has never had an ectopic at all. So I think the caller has just been quite twice unlucky actually, and I'm presuming that this came after her babies, because once you have an ectopic, the general treatment is to take away the ectopic with the tube on the affected tube. And if she has had a second one, it means the other side has also been affected. So I think she has had both tubes taken out. She didn't mention that at all. But the ectopic just means you have the tube is damaged, so that the egg and the fertilized egg is not able to come back to the uterus.
All right. There's Virginia's question. She's been married for 2 years and she has a cyst, so she's wondering, must she go through surgery to remove the cyst?
It depends on how big the cyst is and whether it's causing her symptoms and what nature of cyst it is actually. I think she's probably better off having a discussion with her gynecologist to review this cyst and see whether most cysts are actually very, very small and they do not need any intervention at all. And cysts form as part of the natural process of forming an egg for a woman. So if you scan a woman, on one day you'll find a cyst on the right side. Next time you try to scan her 4 weeks later, you find a cyst on the other side. So those are just natural, the natural process. So unless the cyst is very big or causing her trouble, I think she doesn't actually necessarily need to go through an operation. She needs to have a chat with a gynecologist.
Thank you so much, Daktari. It's been a pleasure having you here and answering all those concerns. And yeah, I think we'll wind it up right there, Sophia.
Indeed, thank you very much for joining us on our health segment, and thank you who took the time to call us as well this morning. And I hope most of your questions, if not all, have been answered this morning.